morning and welcome to HealthChats Preventative Care. Thank you so much for joining us. My name is Tiffany Narvaez and I'm part of the communications team at UnitedAg. Before we get started, I'd like to recognize our sponsors who make all of our programming possible. CVS Caremark, Elite Medical, HCP National, Plantel Nurseries, and Sain. Thank you. Please remember to stay muted throughout the webinar and chat in any questions you have along the way, and we'll answer them at the end of the presentation. We're recording this webinar and we'll email everyone a copy this week. Now I pass it off to UnitedAg Chief Medical Officer, Dr. Rosemary Ku. Rosemary?
Hi, everyone. Thank you for joining me today. Today's topic is going to be focusing on preventive care. And so this morning we'll spend about 15 minutes going over the benefits of preventive care, what to expect during general screenings, things that you'd want to watch out for your mental health. We'll also go over cancer screenings, we'll do some myth busting, and at the end we'll talk about the UnitedAg resources available to you and save plenty of time for Q&A. So first of all, let's jump into the benefits of preventive care. Why should you even take time to do this? A lot of us don't think about it day to day, but it's actually critically important to have all of your preventive care screenings done with your physician. So today, about 60% of adults in the US have at least one chronic condition, and 40% actually have two or more. So the majority of the adults in the US actually have at least one disease, and these diseases are largely preventable. And the majority of them are also ones that you have to control on a daily basis with medications or frequent doctor visits. And having to think about your health on that regular of a basis and to take all the medicines to take care of yourself can actually be quite taxing. And so if you're able to prevent those kind of chronic conditions, you can actually improve your quality of life pretty drastically. Also, the earlier you can detect a chronic condition, the greater your chance of being able to reverse it. A great example is prediabetes, which is the precursor to diabetes. So if you catch diabetes early enough in the prediabetes stage, there's actually a good amount of scientific evidence that you can actually get your body back to normal, which means that you may not ever have to take medicines for diabetes. Also, other chronic conditions like heart disease and high blood pressure are also kind of similar in that with high blood pressure, lifestyle modification early on and being aware of your heart health can actually, reduce your medications. Exercise has been shown to be able to help people reduce their blood pressure by about 10 points, which is fantastic. And that's about the amount that we see with the medication. So there's a lot of things that you can do early on to make sure that your risk of preventable deaths is minimized and that you can even increase your life expectancy by taking care of all your preventive health. So the things that you would probably expect from your doctor for general screenings are these sort of things. I mentioned the prediabetes, diabetes, hypertension, and they'll also do a weight and height to calculate your body mass index for obesity. Some other things that people don't realize that doctors might do for general screening includes infectious diseases such as blood tests for things like hepatitis C or potentially sexually transmitted diseases if you have any risk factors there. A lot of doctors are also screening for domestic violence because that can impact your safety and certainly your happiness and then certainly doctors will assess for lifestyle risk factors. These include substances such as alcohol, if you currently smoke or if you've ever smoked and how much you've smoked in the past. They'll also ask about your nutrition habits. Physical activity is another one that they'll want to make sure that you're physically active. And some of them will also ask you about sleep. And If they don't, you'll want to bring this up during your preventive care visits. If you know that you snore loudly, or you're constantly tired during the day, these are things to absolutely talk to your doctor about, because they can be signs of underlying chronic conditions that could actually be easily treated or reversed. And I mentioned these things to you for what you can anticipate during the general screenings, to try to demystify it. So these are things that you can expect to happen. If they don't happen, you should ask for it. And being more aware of the preventive care that you should be getting allows you to better advocate for yourself. One aspect of preventive care that's often forgotten is mental health. This is just as important as your physical health. And the two major conditions are anxiety and depression that are often screened for. And granted, this is not comprehensive across all aspects of mental health, but this is a starting point. And these are the common questions that you might get asked to screen for depression. The first one is, are you feeling down, depressed, or hopeless? And do you have little interest or pleasure in doing things? You might be asked verbally, or you actually might have to fill out a questionnaire. During UnitedAg's biometric screening, these questions are actually baked into the survey. And so if you kind of have signs of being having depressed or anxiety risk factors here, our health and wellness centers are able to intervene and get you the services that you need, or at least arrange follow-up for you. On the anxiety side of things, the typical questions are around, are you feeling nervous, anxious, or on edge? Or are you not being able to stop or control your worrying? And as you're looking through these questions, if you think about this in your own life, if you are having any of these symptoms on a regular basis, like more than half the week or on most days of the week, you should really talk to your doctor. They might not be asking you these questions every time you go into the office, but these are really good questions to check in and ask yourself. Even if it's, kind of a minor level of anxiety or depression, you're going to want to address it earlier on. You don't want to wait for a crisis to happen, because at that point in time, you might have to take off a lot of time from work, and it could be very disruptive to your life. So mental health should definitely be treated as just as important as your physical health, and action needs to happen at the early stages, not at the crisis point. And from our last webinar, we talked a lot about Spring Health, which is the behavioral health service that UnitedAg has recently signed on as a partner. And you can definitely reach out to our member services if you would like more information about that. They're a really great company that provides hands-on care to help you get to the provider that you need as soon as possible. And they also pair you with a care coordinator who follows you throughout your healthcare journey. So you're never left by yourself trying to figure out what care that you need. There's always someone there that you can talk to and coach you throughout everyday challenges. So I'm going to transition here to talk about cancer screenings, as this is typically what people think of as preventive care. We're going to start with women's health cancer screenings and then talk about men's health. So first off, on the women's health side of things, there is unfortunately no general recommendation for ovarian cancer screening. I've talked to a lot of patients where people typically expect their doctor to have done everything, and if they didn't do any ovarian cancer screening or other cancer screenings, that means that they don't necessarily have to have them. That's not necessarily true. If you do have a family history of ovarian cancer, you'll want to talk to your doctor about that, but there's no general recommendation. On breast cancer screening, the age that this starts is typically 50. This was a change from several years ago where the threshold was actually to start breast cancer screening at age 40. But it was moved up because the benefits of earlier screening for the majority of women were really not seen in the research. But again, if you have family history of breast cancer, you need to talk to your doctor, and this age range can adjust based on your personal risk factors or family history. And then cervical cancer screening through pap smears and HPV tests start at age 21. There are different kind of cadences of doing this type of screening, and that's dependent on the types of tests they do for the pap smears. So definitely talk to your doctor or gynecologist to make sure that you're up to date here. And on the men's side of things, there actually is no general recommendation for prostate or testicular screening. And so this might be a surprise to a lot of men because a lot of doctors are still performing the PSA blood tests or trying to physically palpate for any masses on the physical exam, but it's actually not recommended. This is from the U.S. Preventive Service Task Force. It's not necessary for all men to go through any kind of prostate or testicular screening. But certain demographic groups, or again, those with family history, should talk to their doctor about whether or not they should have some sort of screening done. And then everyone, regardless of sex, needs colorectal cancer screening, and that begins at age 50. And there are a lot of different types of screening modalities for this, all the way from virtual colonoscopies that are non-invasive to full colonoscopies that happen every 10 years. The colon cancer screening can also adjust based on what they find during the test. So if they find any scary polyps or anything looks like that it has a high risk of turning into cancer, you actually might need more frequent screening afterwards. But again, that's based on the findings and the discussions with your doctor. Now moving on to some myth busting. One of the common myths in preventive care that I've heard is that people believe they should take a daily vitamin. Daily vitamins are often marketed to both men and women of all ages. But the formal recommendation from the U.S. Preventive Service Task Force is that they recommend against the use of beta carotene or vitamin E to prevent cardiovascular disease or cancer. And in fact, they did a lot of research on other vitamins as well, including vitamin C, D, folic acid, selenium, and calcium. And none of the vitamin supplements seem to really improve health. And even the studies on beta carotene, which is a precursor to vitamin A, looked like it could actually increase lung cancer risk. So the general takeaway from this is that you don't necessarily need a daily multivitamin to stay healthy. Now, if you have certain conditions, such as vitamin D deficiency, your doctor might recommend certain vitamin supplements, but if you're generally healthy, you don't need to take vitamins on top of that. And also, the majority of the vitamins and minerals are best absorbed through food anyway. So as long as you're eating a healthy and balanced diet with a lot of variety, vegetables, fruit, healthy protein, then you should be getting the vitamins and nutrients that you need. Another myth that I've often heard is that people believe that you should take a baby aspirin every single day. And even though baby aspirin is available over the counter, it's not necessarily something that everyone should take because it does thin the blood. And that's why it's helpful for people who do have risk of cardiovascular disease or stroke, is that it thins the blood enough that that you might not have a major heart attack or a major stroke if there is some blood clotting that occurs. But because of the bleed risk, the risks might outweigh the benefits for you specifically. So you need to talk to your doctor about aspirin and whether that's appropriate for you. And your doctor will basically make that decision based on your cardiovascular risk factors and your bleeding risk factors. But for those who do have cardiovascular risk, generally for people starting at age 50, doctors will recommend a daily baby aspirin, and that can prevent cardiovascular disease and even is believed to prevent colorectal cancer as well. But make sure you talk to your doctor about whether or not that's appropriate for you. And then lastly, I think this is one of the areas of screening that is often forgotten by both patients and sometimes also healthcare systems is that there is specific screening recommended for smokers. And the screening is for both lung cancer and for something called aortic aneurysm. Abdominal aortic aneurysm. Now, for lung cancer, starting at age 55, those who have had a very long smoking history should get an annual low-dose CT to screen for lung cancer. What I mean by a long smoking history is what providers call like 30 pack year smoking history. And a pack year is basically how many packs of cigarettes you smoked a day times how many years. And if that's over 30, and your doctor will certainly, figure this out for you, so you don't have to necessarily do this yourself. But if it's past a certain threshold, your doctor may recommend this type of screening. If you've actually quit for at least 15 years, you do not necessarily need this screening. But if you have been actively smoking a lot over the last 15 years, you should get this kind of screening for lung cancer. And that goes for both men and women who have smoked or are actively smoking. Now, the other screening for smokers that I mentioned earlier was abdominal aortic aneurysm. And what that means is the aorta is a very large artery that goes through the abdominal region. And sometimes over time, it can enlarge. And if it bursts, it's life-threatening. And this actually, the risk of this happening is greater in people who have smoked, and especially men. So for men who have smoked at all and are the ages of 65 to 75, the medical community does recommend an ultrasound that the abdominal aorta looks okay. So if you've ever, I guess that the takeaway message from all this is if you've ever smoked or are currently smoking, specifically ask your doctor about whether or not you need any screening for cancer or an aortic aneurysm, and they can tell you based on your age and medical history whether or not that's appropriate for you and when you need that to get done. So make sure you advocate for yourself there. And then lastly, so that's it for the myth busting that we'll do this morning. And then lastly, I just want to talk to you about the resources that we have at UnitedAg. Right now, with the whole COVID pandemic, I think it's very easy to forget about preventive health because everyone is focusing on, other things and, getting treated or tested for COVID, or there might be fears about going into the healthcare system for chronic disease prevention, screening, or care. But preventive health is it's so important. You don't want to delay any of that. And so our health and wellness centers are still available for general preventive care. And in fact, most people think of our health and wellness centers as for urgent needs, but they're not necessarily meant for that. Our health and wellness centers and the providers there are really meant to be your primary care provider. That means that they will follow you over time. You can develop a relationship with them. They will get to know your whole medical history, so they can tell you what part of these screenings are relevant to you and what you should get, and they can follow up with you with the results. And so it's a long-term relationship that our health and wellness centers will build with you. So don't think of them as just urgent care. Think of them as really your primary care provider. And we are still working on organizing biometric screening, and we will be working on flu shot events as well. Now, if you would like to have a flu shot event for your organization, contact our client services department. And if you're going to do that, make sure try to give them a sense of how many employees might be interested in the flu shot. That would really help them out in terms of planning. But I just want to end with the fact that we're here for you. We definitely want to make sure your preventive health is optimized. Even throughout COVID, we haven't forgotten about this, and our health and wellness centers are there to service all of your needs across the spectrum of acute and primary care and preventive health.